So when the FDA approved Ruxolitinib, Opzelura in the summer, I got about 300 phone calls from patients who all wanted it. And so we were, we were experiencing this need for prior authorizations and discussions with payers. And over time, we've seen improvements. So it took a little while for the drug to be added to formularies, first of all. So a lot of times, some of the responses we were getting very early on was, this isn't FDA approved for vitiligo. We were like, oh, it is. Just, so it took a few months for that to happen. And one of the challenges is state to state, things can be very, very different. So I know Massachusetts very well because I'm prescribing and I'm seeing results here. We're seeing, around 2/3 or more of patients getting coverage for Opzelura. So that's very encouraging after a prior authorization. And other states can be different. And actually, Mass Health, which is our public payer here in Massachusetts, has approved it and added it to their formulary. So that I think says a lot. So we're very optimistic. We have a very good team who are doing the prior authorizations and helping to kind of grease the wheels. And Insight also has, for those who can't get it covered, also has a program to reduce cost. And so there are lots of options, and I think it's very helpful to know them all and to have a team supporting me makes it easier for me. But we're actually getting a lot of patients who are using the drug. Yeah, I mean, most people who come to my clinic are asking for it by name. They know it. There are commercials on TV now. Anybody with vitiligo who's, particularly if they're coming to me, they're savvy. They're reading a lot beforehand. We've talked a lot about it. I write a blog, and so patients are aware that this is out there. So a lot of people are coming and asking for it. Now it's just one of the options that we present to patients. And it's the only FDA-approved treatment, right? So the other options, the conventional options, are not FDA-approved. They're also a little challenging. Prior to the FDA approval, we were using class 1 topical steroids, which cause lots of side effects over time. So we had to use them in an interrupted way, alternating with tacrolimus to prevent those. Got very confusing for patients, 1 week on, 1 week off. But when you're on your off week, you're using this other cream. And by the way, on your face and your genitals and underarms, don't use the class 1 steroid at all. Use the other one fully. And patients would come back confused. And the tacrolimus is in a ointment base, so it was very greasy, and people didn't like that. And so now, the option of the Opzelura, which is in a cream, patients prefer that over the greasiness, and it's simple. They can put it on any part of their body, without taking a break. It's just easier to explain. So patients appreciate that. We talked about some of the nuance. It's FDA approved only for 12 and older. So we have lots of kids who wish they could get it. And it's just not that we think it's unsafe for younger kids. It just hasn't been tested in clinical trials, and tests are ongoing now. It's also FDA approved for 10% body surface area or under. And so there are multiple interpretations of that. So, if somebody has 20% body surface area of vitiligo, is it okay for them to choose 10% and use the cream on 10%? Some payers are saying, no, if they have more than 10%, if they have 11% body surface area, we won't give them the cream at all. But it's very reasonable for patients to say, look, I've got 20%, but I want to put it on my face and my hands. That's really what I care about. And so we're learning how to talk to payers and explain to them. Also, segmental vitiligo, which is a subpopulation of vitiligo patients, where the vitiligo is limited to one part of the body and doesn't cross the midline. It is not FDA approved for that treatment. Although we feel like if caught early enough, it will work for that. It wasn't tested in clinical trials. And so, explaining in your note is very important. What type of vitiligo is it? Is it segmental or non-segmental? What's the body surface area for approval? Those are important parameters. Yeah, it's an interesting dynamic that I wasn't expecting early on when I started. Psoriasis patients, for example, don't push back against treatments and say, "Oh no, psoriasis is beautiful. I want to keep it. I don't want to treat it. It's part of who I am." Vitiligo is a little bit special in that way. We also don't see it with atopic dermatitis or eczema. We don't see it with alopecia areata. But we do see it with some other conditions, with albinism, or in the deaf community. Some people opt for treatment, others, can even be offended that some are opting for treatment. How we define vitiligo has been pushed back a little bit too. So it's an autoimmune disease. It is a disease, and some people don't want to hear that word. They don't want to hear it called a disease. They say rather it's a disorder or it's a condition. And I understand that actually. That is a reasonable perspective that, hey, also just the use of the term patients, vitiligo patients. Not everybody is a vitiligo patient. You become a patient if you choose to go to the doctor and get treated. But many choose not to. And so that term, really, it's individuals with vitiligo. Patients are those who choose to go to the doctor to get treated. Those who don't and accept their appearance and their condition is perfectly okay. It's a minority of the total, I think. It's a small voice, but it's a loud voice, as you can imagine. Those who decide to accept it can be very vocal, and they see themselves as advocates for others, which is great. So there is no right or wrong perspective on vitiligo. If you accept it and appreciate it and don't want treatment, that is a very healthy perspective. And if patients come to see me, very few do, right? Given that kind of selection bias, they're going to come to see me more if they want treatment. But if they do come to see me and say, I just want to make sure nothing else is wrong, otherwise I accept it, then that's my message. Great, congratulations, you're going to do fine. But we can't use that to negate all the rest of the population, the 95% of the population who really do want treatment. And we need to make sure that message is out there, and that we remember that it's important to ask the individual that we're interacting with, my patients, how does this concern you? How much does it bother you? What is your approach, rather than going in there with one mindset and saying, oh, you have to treat this way. They don't have to treat it all, or they can treat another way. So we need to be humble, I think, as dermatologists who are taking care of these patients, and really have a conversation with them to understand what they need.